Thank you so much for joining us here at Abu Dhabi Global Healthcare Week. It's the inaugural week for this summit here in Abu Dhabi.
Phenomenal.
Walk me through, in your mind, some of the revolutions we're going to see, not just in the move from healthcare to health, but also in the AI space.
Well, I think it's really fascinating is that we've been chasing, I guess as a community, cancer for years. And I think cancer for many years was you either cut it out, you burn it out, starve it out. And that was sort of state of the art. And we're adding more things like radio-oncology, everything else. But in the last 3 years now, we can actually see the source code to life. That's amazing. We're just now starting to understand it. And now we can understand it, we can debug it, we can fix it, and we can repair it. And so we're starting to see is there's early things like in drug trials, say HER2 positive cancer, where we're literally finding the code for the cancer for that particular woman and using that to do immunotherapy to make it go away. That's incredible. And so what I'm seeing here today is an awful lot of people starting to think about, and companies, how do you take data over time that you've seen from patients like you have here in Abu Dhabi and use that to actually understand these transitions and then use AI, because AI essentially is doing what we've done for years as humans, but at a much higher dimensional level. And that's really where I'm starting to see an amazing impact.
Do you see this as the road to a cure for cancer?
I mean, I think, cure do you cure diabetes? It's really becoming a manageable condition. So today, if you have sort of a diagnosis of cancer, it's becoming a treatable condition. So much like you have diabetes treated with insulin and whatnot, it's the case where now with cancers, we're starting to see some areas you actually go in for regular treatments. It's no longer a mortal diagnosis, but more of an annoyance and something you can manage. And that to me is a wonderful future.
Okay, so within keeping with that, so many of the folks that we've been speaking to have been discussing the idea that traditionally we're seeing things in the global south left behind. In your mind, how are the discoveries being made today and the investments being made today in science, in technology, in AI going to change that dynamic?
Well, I think what you're seeing on a world stage is, AI sort of excited a lot of people. It's the first thing we've seen that gives you a productivity boost of 40% or more. We haven't seen that since literally electricity. And so that to me is going to fundamentally shift. And now you see this particular part of the world thinking, what happens post resources, non-renewable resources. And I think they're being very smart, saying, if we can help the world get that productivity, we can really contribute. And really, and the same thing, they now have data that the world would love to get access to in terms of the insights from the data, not the data itself. And I think they're being very smart about that, saying, how do we allocate capital so we can contribute to the world's health? And then it becomes a future revenue stream for the area, but also it helps the entire planet. And so now we're just trying to figure out how do you bring together the data and intent and desire you have in this region, right? With the bold vision of 2030 vision and beyond. How do you marry that with the world's best oncologists and the world's best technology to actually essentially change the world in terms of how we deal with healthcare and cancer?
What is the biggest challenge in your mind to democratizing healthcare?
There's a couple points in here. One is to get access to the data at that scale where you can use machines to find these patterns. Today, that's very, very expensive. It used to cost $1 billion not that long ago. Just 10 years ago, it was in $8,000 for one test. There are technologies now in the lab, where I come from in Palo Alto, where we can actually do this for $5, right? So the cost is plummeting, right? That's number one is cost and access. And the second thing is data. So how do you find these data over time that's been carefully collected so that we can teach machines to help us find these patterns? And so now we're just here just trying to figure out how we work together to pull this off.
It's a fascinating move, isn't it? And when you look at what Abu Dhabi is doing specifically in terms of allocating capital, investment,
Right.
and the vision and leadership that it takes to do this, what is your greatest concern? Is it, as so many people have suggested, privacy concerns around the data? Is it safe for people to understand individual genomes?
Absolutely, I believe it is, absolutely. I think there's two challenges that I see right now. One is basic awareness, right? A lot of the oncologists and people that I meet throughout the region, super smart and great backgrounds and more traditional trainings. A lot of them went to school 20 years ago, 15 years ago. So one is awareness of what's actually possible. And once you have awareness of that, so I work with some oncologists, for example, and what that is like, how do you educate the world on what's possible? The second one is, how do you make it practical? So I see the potential where it can come for like diagnosing cancer. I see the word cloud can play, but how do I change my practice like right now, right? And so the second thing is, how do you get access to these actual technologies? And if you're going through those, you want to talk to regulatory bodies and others figuring out how do we very thoughtfully get access to this, where we preserve the privacy of the individual, yet we allow the patterns that they can enable to basically be spread across the planet. And that's a nuance we're working with the governments on, of like, how do you actually allow the sharing of insights without exposing the individual, right? And there's some really powerful technologies that we can bring to bear to do that.
Finally, when you think about what happens next, this is the inaugural summit here in Abu Dhabi. No doubt there'll be a lot of interest in partnering with the government. For Google, I know that this is a company that has been at the forefront of innovation, much like Abu Dhabi. The UAE has continued to be an incubator for innovation. Right. Where do you see the possibilities?
I think that what we're seeing here in this particular region is they've collected some of the most valuable data on the planet. You need data that's been very thoughtfully collected. We have some of the best genomic minds here in Abu Dhabi and the other regions, and they collect it over time. And so now we're trying to figure out, how do you connect that data set in a privacy safe way to allow the best minds in the world to collaborate to find these cures. And we're seeing it done everything from, just I think last week, they're showing some of these technologies you can actually repair deafness. I'm seeing it repair blindness. The sort of things that used to be biblical, right? We're now actually happening. And it's down to the level of understanding our bodies at this scale. And so to me, I think this is going to be some of the most rapid change we've seen in our lives just in the next 5 years.
Great to have you here at Abu Dhabi Global Healthcare Week. Thanks so much for joining us.
Thank you very much.